Howdy everyone! We are back with the first proper installment of this semester's iteration of the Wellness Wednesdays. Today, we will be talking about type 1 diabetes. To tackle what diabetes is, we have to start off with some basics. When you consume food or sugary liquids, these substances are broken down into a simple sugar called glucose that then enters your bloodstream. This glucose acts as an important fuel for your cells that comprise your body. For glucose to be able to enter your cells and act as a fuel for them, another molecule called insulin needs to interact with the cells. Insulin, it kind of acts as a key where it can unlock the cells for the glucose to enter them, making insulin a vital part of how your body uses the energy you gain from eating food and drinking. However, when there is a failure for glucose to enter your cells, this is called diabetes. There are two forms of diabetes. Type 1 diabetes, where your body makes too little insulin, and type 2 diabetes, where your insulin isn't able to reliably unlock your cells for the insulin to enter them. Both of these conditions lead to elevated levels of glucose in the bloodstream, which is effectively how diabetes is classified, and why type 1 and type 2 diabetes are often grouped together, despite having two very different causes. As a part of this series, we also hope to help teach some medical terminology. To start off with, diabetes is scientifically known as diabetes mellitus. The word diabetes means passing through or a large discharge of urine, and the word mellitus means pleasant tasting, like honey. So therefore, diabetes mellitus literally means a large discharge of sweet tasting urine, which actually describes how people with untreated diabetes have elevated glucose in their urine alongside a need to frequently urinate. The need to urinate at an abnormally high frequency is medically known as polyuria. Poly means many and urea means urine. So polyuria literally means excessive urine. Polyuria is caused by hyperglycemia. Hyper means a high amount of, and glyco means glucose and other sugars, and emia means a disease or abnormal condition of the blood. So hyperglycemia means an abnormally high glucose and sugar level in the blood. Hyperglycemia occurs in diabetes when someone eats something, but the body isn't able to have the glucose properly enter the cells, leading to a rapid accumulation of it in the blood. The root cause of this failure in type 1 diabetes is due to the immune system. The immune system is able to target and destroy cells in your body that it identifies as dangerous, which is how your body is able to combat illnesses like the flu. However, sometimes your immune system malfunctions and attacks your own healthy cells. This is the most common cause of type 1 diabetes. The immune system attacks cells in the pancreas that produce the insulin needed to unlock your cells. The destruction of this important insulin-producing cell leads to a chronic lack of insulin in your bloodstream, causing type 1 diabetes. This is a simplified explanation of the type 1 diabetes causes, as type 1 diabetes can be caused by a wide range of factors like environment, genetics, and how a person's metabolism and immune system operates. So not all people with type 1 diabetes share the same cause of their affliction. Type 2 diabetes occurs when your pancreas does not produce enough insulin. However, the insulin that is produced isn't as effective as it should be, preventing glucose from entering your cells. Your chances of developing type 2 diabetes are increased if you are overweight or obese, physically inactive, have high blood pressure, or have a genetic predisposition to it. It is also difficult to tell when you do develop type 2 diabetes, as the symptoms develop slowly and over time, so they may not be easily recognizable. There are many symptoms of diabetes, but common ones include polyuria, like we discussed, it was excessive urine; polydipsia, poly meaning many, dipsia meaning the need to drink, so polydipsia is excessive thirst or unexpected weight loss; tiredness, blurry vision, numbness or tingling of the feet, sores that don't heal, and diabetic ketoacidosis. Ketoacidosis is a particularly dangerous symptom of type 1 diabetes, to the point of being life-threatening. The word can be broken down into keto, acid, and osis. Keto means ketones, acid just means acid, and osis means a condition or status. So ketoacidosis means an acidic condition of the blood caused by excessive ketones. Well, that probably doesn't make a lot of sense, as ketones is also an unfamiliar term. When your body is unable to use glucose as a fuel for its cells, ketones are the alternative to it. Ketones are basically a kind of replacement fuel for the glucose. Ketones are produced in your liver and they are made by the liver, converting fat into ketones. However, the issue in diabetes is that when the liver sees that the cells in your body aren't getting the fuel they need from glucose, it starts producing ketones, and a lot of ketones. Way too many, in fact. Ketones are slightly acidic, so when your body produces a large amount of ketones and puts them into your bloodstream, it causes the blood to become too acidic and disrupts various processes important to keeping you alive. Hence, for people who are diabetic, it is vital to avoid diabetic ketoacidosis. So if you have any of the symptoms of polyuria, excessive urine, polydipsia, which is excessive thirst, or unexplained weight loss, it may be good to get tested for diabetes by your healthcare provider. Diabetes is usually diagnosed by a blood test, but it can also be diagnosed by a urine test if a person's veins are too small to have their blood drawn from them. There are 3 kinds of blood tests for diabetes. One of them is a random blood glucose test, which can be done at any time of the day. The second test is a fasting glucose test, which requires you to fast the night before you get tested. And the third one is a glucose tolerance test, where you are given a sugary liquid and you are tested after 1 hour and after the second hour. The results of all of these tests are measured in milligrams per deciliter. So 1 milligram per deciliter means that there is 1 milligram of glucose molecules for each deciliter of blood. So for the random blood glucose tests, the one that requires no preparation, if the glucose result is 200 milligrams over deciliters or higher, then that means the person is diabetic. For the fasting glucose test, the one where the person fasts the night before being tested, a person with a result of 126 milligrams over deciliter has diabetes. For the glucose tolerance test, the one where a patient drinks a sugary liquid and then has their blood tested 1 and 2 hours later, a result of 200 milligrams over deciliters or higher indicates diabetes. That's all we will talk about for this video, and make sure to tune in on the next Wellness Wednesday video where we will continue where we left off. We hope you all were able to learn a little bit more about diabetes and the symptoms associated with it, how both types of diabetes work, and how you can be tested for diabetes. Bye, have a great week.